Hi, in this presentation I'll be introducing Usdl, short for Ultrasound Deep Learning, inexpensive medical imaging using deep learning techniques and ultrasound technology. Ultrasounds, one of the most commonly used medical imaging modalities today, is recognized for its cost efficiency, versatility, and portability. Ultrasounds are used to diagnose many conditions. However, ultrasound imaging is merely a tool for initial diagnosis. Millions throughout the world suffer from a lack of access to proper medical facilities and expensive diagnostic medical imaging equipment. A major obstacle that limits the scalability of ultrasounds is the presence of speckle noise, a granular interference inherent in ultrasound images. It results in inaccuracies on image-based interpretation of tumors, cancers, and other abnormalities. The presence of noise in ultrasound images makes it difficult for users to detect these diseases at an early stage, thus allowing it to progress to a worse, untreatable condition. So what's our solution? Meet Usdl, short for Ultrasound Deep Learning. Usdl is a novel tool that employs deep learning techniques to reconstruct and enhance noisy ultrasound scans for more accurate image analysis. Our approach to developing Usdl consisted of 3 stages: data collection, model development, and testing. In order to reconstruct images with sufficient accuracy, Usdl requires a vast amount of data for training and testing purposes. Since most ultrasound datasets are private sector, we developed our own dataset consisting of 15,700 in vivo images from the vascular regions of the neck, knee, wrist, and elbow, as seen in Figure 1, to cross-verify and allow Usdl to be applicable to many regions of the body. As you can see in Figure 2, the architecture was built around an unsupervised neural network called an autoencoder, which learns how to accurately remove noise by reducing, then resizing the dimensions of the ultrasound images in the dataset. In order to raise the efficiency of our algorithm and maintain a standardized dataset, the data were converted to grayscale and resized using OpenCV Image Processing API. After the images were pre-processed in OpenCV, the artificially corrupted dataset is fed into the autoencoder model. The model utilizes convolution on the matrix representation of each image in the dataset and then condenses the spatial dimensions of the results. Afterwards, this process is fully reversed to form the output. This output is then compared to the uncorrupted dataset using a mean-squared error loss function in order to identify how accurate the reconstructed training image is to the original training data. Afterwards, we feed these results into an atom optimizer function in order to update the weights of the neural network. After the weights of the neural network are updated, the entire process is repeated over and over again many times in order to increase the accuracy of the reconstruction, as represented in these graphs, where after every epoch or traversal of data, the error or loss is calculated. After the model is trained completely, it is able to reconstruct ultrasound images that exist outside of our dataset. To gauge our model's proficiency, we utilize 2 standard measures indicative of image quality: structural similarity index, or SSIM, and peak signal-to-noise ratio, or PSNR. SSIM accounts for luminescence masking and contrast masking. Essentially, it focuses its measures on areas of high activity. PSNR is simply a pixel-by-pixel comparison. Following a rigorous testing process, Usdl exhibited an average SSIM reconstruction accuracy of 90.14% and PSNR reconstruction accuracy of 40.628. Feel free to pause the video to take a look at Figures 7 through 10 for a visual comparison between the original images and Usdl reconstruction. When compared to other denoising techniques involving ultrasound imaging, our platform is unique, as it doesn't tackle issues in beam formation by suppressing signals. Instead, the model provides significantly better results by producing higher quality reconstruction. Feel free to pause the video to take a look at Figures 11 through 12 for a comparison to other denoising techniques. Currently, our model is a proof of concept for a method to image the brain. Our model simulates cranial ultrasound scans by artificially adding 90% speckle noise to our training dataset. We plan to acquire an extensive set of cranial images to train our model and improve Usdl. Our platform is currently intended to be used on static images. Our next goal is to integrate Usdl with real-time imaging to increase applicability. Thank you for watching.